Welcome to another episode of Health Hustle Chronicles, where the grind meets growth in the world of healthcare. As you know, this ain't your typical podcast because I bring you some of the freshest, some of the livest guests from around the world, Craig. And today we have a very special guest who goes by the name of Dr. Pierre. Dr. Pierre is the president and owner of TRImani Consulting LLC, a leadership development and executives coaching and consulting firm. Dr. Pierre serves the leadership needs of healthcare executives and providers, education sector professionals, IT firms, and government sector professionals. Dr. Pierre has over 33 years of service in healthcare in frontline and leadership roles with various organizations. Dr. Pierre also serves as an adjunct professor of graduate studies for health administration, nursing, and public health programs for over 10 years, an assignment which he continues to love. Dr. Pierre serves as the regent for American College and Health Care Executives, also known as the ACHE, Texan Northern Division, and served on the board of directors for ACHE North Texas chapter from 2021 to 2024. She is also a proud member of the National Association of Health Services Executives, known as the NAHSE DFW chapter, and is an advocate of progressing the development and advancement of Black and minority leaders within healthcare and other business sectors. One element has remained the same throughout her career. Dr. Pierre, she loves teaching, guiding, and mentoring healthcare professionals. It is her passion, and this passion is at the heart of what she does. Dr. Pierre, she's received her Associates of Science in Nursing, known as the ASN degree in 2000, her Bachelor's of Science in Nursing, known as the BSN in 2006, and her Master's of Health Administration, known as the MHA in 2010, and her Doctorates of Health Administration, also known as that DHA degree in 2015. In addition to her registered nursing license, her certifications include Certified Career Coach, Certified Executive Coach, Certified Healthcare Leaders Coach, Fellow of American College of Healthcare Executives, known as the FHCHE, and a Nurse Executive Advanced Board Certified member. Dr. Pierre published her first book called Leadership Legacy, using insight from your past to build a legacy of success in 2020, and introduced Thrive at Leadership, her Leadership Success Academy for healthcare nurse managers and business professionals in early 2024. Dr. Pierre, she enjoys spending time with her family, hosting movie and game nights at her home in DFW, engaging in biblical research, cooking, baking, spa days, exercising, singing, as well as traveling. Let's put our hands together and welcome Dr. Pierre to the stage. Hey, Doc,
Good morning. How are you? Thank you so much for having me. I'm so excited to be here.
I'm excited to have you. I was already super inspired reading your bio. I was like, what? Aww. Okay, 2000 she did this, 2006 she did that, 2010 she did this, 2015 she did that. So it's like you staged it like you were having kids. I was like, this was interesting. I love it.
Well, I wouldn't say I staged it because I went kicking and screaming. I would say, won't he do it?
Won't he do it? This is amazing. I love your bio. What haven't you done? What are we going to get you in the White House?
Oh my. Oh, different podcast. Oh.
Well, listen, thank you once again. Welcome to the show. It's a beautiful day outside and I'm blessed to have you on the show. And so
thank you.
Yeah, let's kick this thing off. Introduce yourself to the world. Let us vibe with you, understand your personal journey and as well as your background. So who is Dr. Pierre personally?
Well, Trinette is, and I go by Trin, that's cool with me. I'm somebody who loves to love. I love to have a good time. I love to enjoy life. I believe that every day is a blessing and a miracle. So I try to live in that moment. But I would say that wasn't always who I was. There were moments in life when I was so bogged down in just doing in the professional realm that I kind of lost some of my personality. And as you can tell, that's a lot to lose because I'm one of them, I'm here I am, boom, bam. But I realized that I had to make this transition from being what others thought I should be into being who God called me to be and who
Okay.
I want to be and how
Okay.
I want to show up. So I entered the nursing realm oh, 24, 25 years ago. Before that, I was in healthcare in various aspects of the field. But the reason I got in is because my eldest sister, Carmel, she was a neonatal ICU nurse. And I've always looked up to my sister. She got a few years on me, just a few. And I looked at her journey, what she did, and how she loved on her patients in the neonatal ICU. And not only the patients, but the family members who were there going through horrific times when you think you're going to have this Gerber baby that you can rock and take home.
Right.
And then you look up and you have this situation going on. You don't know if they're going to be in the hospital for 3 months, 6 months. But I watched how gently she cared with them and how she went above and beyond trying to ensure that they were well cared for. And I said, I want to do that. And that was the reason I got into nursing, watching what my sister did and how she loved on people at the worst times of their life and some of the scariest times. So I got into nursing and initially I thought, yeah, I'm gonna rock some babies like my sister did
Right.
and nurse them back to health and pat some mommies and daddies on the shoulders. But I went into critical care nursing for adults after a while. After labor and delivery and all that stuff, I went into critical care nursing, a realm I never thought I would enter. But as we often say, God laughs at our plans, right? So I went into that aspect. And one of the things that I really noticed along the way is I was connected to my peers. But as far as the nursing realm, I kind of always felt like I wasn't ever going to move up and progress forward.
Okay.
I went
Okay.
into leadership roles after a while, and that was great because I was able to affect change and implement some changes on the level where I was, which was a frontline manager of a critical care unit. And I was able to do phenomenal things and start a unit, start a level of care at one of the hospitals where I worked. And I worked with phenomenal providers and teams to get that up and running. But I always felt like there was a block somewhere, regardless of how much work I put in, whether or not I showed up, I was there for 12 hours versus 16 hours. I always felt like there was something more. And then I started saying, okay, maybe if I move up further
Sure.
within the hierarchy of the healthcare profession of the organization and move into chief level roles or executive VP. So I started on that track and I noticed there were constant blocks.
Mm.
No matter what I put in for, it was nope,
Mhm.
nope, nope. But on the flip side of that, I had these same individuals, chief level, VP level, right? Board
Right.
level, come into my office to ask questions about what do you think
Mm.
we can do to further progress in this healthcare arena. And there was a disconnect to me because on one hand, I'm giving a lot of advice and getting praise for everything we're doing behind the scenes, in conference rooms, behind closed doors. But out in public, this was not relaying.
Mm.
Nobody was getting all of that extra. It was just, oh, well, we're going to keep you right here because you're doing good for us here. And that was how I felt after a while. And then came the disdain. When we feel that way, I believe our feelings are very real.
Sure.
This is what we're going through. Don't ever let anybody tell you that what you're feeling is not real. It's real. It's reality, but it's not true. And then I started digging deeper and wondering why. Why can't I move forward? Why can't I move on? Why can't I do this? Why can't I? And it was because I had a different level of calling going on.
Mm.
God showed me something different. I was like, okay. So in 2020, after probably a good 15 years in leadership and constantly hearing no, 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 I realized it wasn't human beings that were trying to block me from going in certain doors. I think it was a divine utterance
Oh, this
saying,
is
hey,
deep.
no, I need
Yeah.
you in that. Yes, I need you in that door. One morning in 2018 is when I was told, you are coming at this from the wrong direction.
Okay.
Yes, I want you in healthcare. Yes, I want you to continue to have impact there. But something you've been doing is what I really want you to focus on. And that is guiding and leading and supporting people who need to find clarity in what they're doing every day in the healthcare realm. And it kind of blew me back because I was like, I am a nurse. This is
Right.
what I do.
Right.
I can pass on, I can tell people how to do, I train people in that. And then I started thinking back on all of the things that I'd experienced. Everything from people coming to my office to get advice, people who were multiple levels, layers ahead of me or above us in the hierarchy of the
Sure.
organization, to people saying, hey, somebody told me that you could help me zhuzh up my resume, or you could walk me through a mock interview because I'm interviewing for this position. And all of these things really brought joy to me. And it was in that moment that I realized that was what I enjoyed more than anything. So while, yes, I'm still in the healthcare hustle, as we call it,
Right.
I'm
Right.
coming at it from a different realm. I'm there to support and guide and nurture those who are making impact in our organizations. So hopefully I'm influencing the influential.
Listen, this is you. I mean, you've given a lot of meat on the bone already. There's so many different directions that I can go with this, and I can't wait to dive into it. And I think first I want to start out. You said someone told you that the way you were handling this, you were going about it the wrong way. Was this an individual? Was this spiritual? Was this a divine voice? This someone. Who is this someone? I mean, you don't have to
This
name who they were.
someone is
Yeah,
Holy Spirit. He
got
was
it.
like, listen, we can keep it right here.
Right.
You're doing great. You're doing fine. Everybody knows your name. Wonderful. And I'm so proud of you, daughter. But there's more. And
Wow.
it was a scary moment
Mm.
because it's like, this is what I know. I had one of those Abram moments, pick up everything and leave your family and go. I was like, I don't do the land where I will show you. But
This.
he was like, you're going to have to trust me on this. And I was like, okay. So it was one of those, let me develop you right now to do more of what lights up your eyes when you're asked to do it. Do you see where your real joy is? I'm not telling you to take off your nursing or your healthcare leadership hat. I'm just telling you to add some glitter to it and tilt it to the side because we're going to be doing something else with it. And I think when I look back over my journey, all of the things that God has allowed me to experience, and I've been blessed to experience all the no's, all of the blocks that I thought were coming from human beings, which no, it was divine intervention. All of the things, the education, and even becoming a professor in a time when I was getting my doctoral degree and I was moving a whole hospital to a new location. It was a
Right.
lot going on. And one night I woke up in the middle of the night and said, I'm bored. And most people thought, what is wrong with you?
Right.
I
Right.
actually
Right.
told some of my people in the hospital system, they were like, you're building a new level of care in the hospital. You're working on your dissertation. You bored? And I was like, yeah, I'm kind of bored. So at that moment, that was another divine unction for me to get that Doctor of Health Administration degree because he knew that down the line, it's been 10 years, down the line 10 years, I would have to stand in front of those I needed to influence, to impact them, to make certain changes, to support them and guide them. So all of the things, as I look back over the journey, a friend of mine just told me the other day, he said, it's amazing to me how when we're driving in the car, all we see is what's straight ahead of us.
Sure. Yeah.
But every once in a while, we need to take a peek in the rearview mirror. I was like, you just preached the word right there.
Got you.
He
You're
said,
like, yeah.
yeah. And I was like, that's Holy Spirit, because he's telling me in this moment, look back over all the things you thought were troubles and trials and tribulations. Speak, Lord, and think about how all of that has helped develop you when you were alone, when you were crying because if you didn't fit in with them, if you didn't talk like them, if you didn't laugh at their jokes, if you didn't, as one person say, your hair looks better when it's straight, it looks more professional.
Right.
When you're hearing all of these things and you're
Yeah.
hearing all of the no's, yet I'm taking you step by step on this journey that you didn't even know you were on. Now look back in the rearview mirror and see. Hindsight is always 2020. I'm straight blinded,
Mhm.
until I get to the point where I can look back and see the why behind all that I had to go through. And I'm so thankful for the journey that has been my life. It took me a while to realize, I ain't gonna lie, it took about 45
Right.
years to realize what was going on behind the scenes, but I'm very grateful to be doing what I'm doing now. And I'm grateful for the no's because the no's in human voice was a yes in his.
You've given me chills just listening to you. I mean, and these are good chills because I'm feeling the spirit, I'm feeling your energy, I'm feeling everything come through this camera, and it feels amazing. And I want everybody else to be able to vibe with this as well because there's so much you shared right there. One, you was inspired by your sister. She was in the neonatal. You ended up in critical care. So you was, pretty much same thing. The most critical at need, you're impacting them. You're starting rising through the ranks in healthcare, only to find that there is truly a ceiling, especially for people that look like you, right? And then there was a pivot, and the pivot was brought to you in this way through spiritual awakening, right? That led you to continue to progress to help others do something similar, to find their voice, find a path forward. And someone told you, you know what, every now and then it's okay to look back. And then looking back, you found that self-reflection and you were able to say, you know what, I did that. Like I did all of that and some, and I'm still moving forward.
Yes.
Did I
and I've learned. Oh, you recapped it. You did that. And I've learned many times we cannot see. In 2018, when I got that word, I was like, I went kicking and screaming. I must tell you, because all I'd known up to that point was I was a W-2. I was working for somebody else, and I got a check like clockwork every 2 weeks, and it better not be a day late, right?
Right.
I had direct deposit in banks. I researched them out to make sure it showed up 2 days early.
Right.
But I went from that to now just trust me to provide the manna in the wilderness while you go through this journey. And I'm like, that doesn't sound very appealing, you know? So, and he was like, I'll drop some quail every now and then. Don't worry about it. I got you. But at the end of the day, one of the things that I focused on hearing that day after day after day, it wasn't until the beginning of 2019 that I really, really got on board with it. And I started working on bettering myself in that role, developing myself and getting my certifications. So from 2019 to the end of 2020, that's where I was. I was working to develop. I was not completely bought in. From 2020 to 2022, all I could think about was, I'm about to leave all I've ever known. I am uprooting and leaving the land that I know to go to a land that you promise you will show me. And it was a lot in that moment because I had a team and providers and all these people who depended on me. And I was known as the person in the healthcare realm in that organization and some others I've been in where I knew the answers. People come to me and get the answers, right? You know, and sometimes we label ourselves as many celebrities say, you're kind of cast into this role and that's all they know you as.
Yep.
You can't go from being a sitcom star to overnight going into deep drama. And I think of Halle Berry, right? When they told her, you're not ugly enough to play this role. You can't possibly play. And they gave her a chance. And guess what she did? She won the highest honor of that role she played, right? But there are many times where we're looking at this thing that God has called us to, and we're wondering, is this gonna work out? But that's where faith comes in. And I've learned that is where I got developed. When I said, you know what? Faith isn't what you see or what you feel when everything is going good. It is literally, Holy Spirit showed this to me. It is you being on the staircase and picking up your foot, even though you don't see the next step. You don't see it, but as soon as you put your foot down, I'm going to show you what's always been there. And it's like, but that's scary. I don't know what to do with that. So from 2020 to 2022, I fought and fought and fought internally and externally. I would be in my room at 2 a.m, up pacing the floor. I don't want to leave my team. They depend on me. And finally, another friend with the word, tell me he won't provide what you need. Another friend with the word came to my office and she was leaving the hospital where we are and she was going into a higher level role in another organization. She too faced a lot of blocks. You know, give me all the advice and the knowledge you have, but no, we're not going to increase your salary and increase your status. So anyway, she came to my office one day and she said, I just have this word and I think I need to share it with you for such a time as this. And I'm like, okay. She said, the assignment here is done. And this was in early 2022.
What was the assignment?
The assignment, she said, the assignment here is done. You've done what you've been called to do here in this realm. And now your next assignment is waiting for you. There are people who are depending on you in that realm. So
Mm.
don't stifle yourself and lose what God has given to you sitting here for another 30 years. Move forward. Move forward and go where he's
Mhm.
leading. And that evening, I believe it was, God forgive me if I got that wrong, but I believe it was that evening. I went home and I was like, in 2022, I'm like, Lord, I don't know what to do. I don't know. He told me start putting yourself out there. Start looking for requests for proposals online and put in bids for it. I'm like, I have never done anything like that. But he told me, just child, listen, open these, listen to what I'm telling you. And I'm like, all right, I'm not good at that, but all right. And he needed to teach me some things in that realm. But I started listening and I got on my computer. I'm like, I have no idea what I am doing. Couple of months later, I got an email from one of the largest independent school districts in DFW saying, congratulations. Congratulations. We want you to be a consultant on our list of consultants. You are now an approved consultant. I was still in the hospital at that
Okay.
time.
Right.
And when tears coming now thinking of it, because I was like, that's confirmation. He was like, how did he look at us when he do what he always do? And we like, wow, I can't believe you did it again.
Right.
I show up and I'm like, thank you for showing up for your kid. So I got that and I was like, okay, it's time for me to start telling those around me and preparing them for my exit out of here. Now, this is
Mhm.
2022, probably spring of 2022.
Okay.
And then
I
I'm like,
mean,
but Lord, I really don't know. I really don't. Is this really you? And he like, and
I mean,
so my Bible is literally sitting on my bed and I'm pacing back and forth going, I just need you to show me something. Show me which direction to go. Show me what you need for me to see in this moment. My Bible, now my ceiling fan was on, so I'm like, maybe it was just a fan. My Bible flipped to Joshua
okay.
chapter 1. I went directly to the verse, chapter 1, verse 9. Be strong and courageous. Do not be afraid or discouraged, for the Lord thy God is with you wherever you go. Floored. Fell on the floor bawling. I mean, ugly crying. I was just
Oh,
on the floor, like, what?
oh,
And then he said, pay attention to how many times you see and hear this verse in the next couple of weeks. 2 days go by. One of my sisters, Angel, sent me this in the text. I don't know why. The Lord told me to tell you, read Joshua 1:9. You got to be kidding me.
mhm.
Day later, I hear a sermon preached on Joshua 1:9. A couple of days after that, my sister, another sister, Joshua 1:9. Before I left, I think this was July, they threw me a couple of parties in the organization where I was at the time. And it was very somber and very dark. I knew it would be because I
Right.
loved them and I mean, we were tight, tight.
Yeah.
So one of my nurses, she came, she was like, oh, Miss Trinette, I wanted to bring you this. And I'm like, oh, okay. And she said, I want you to open it now. And I did. And it was a plaque that said, be strong and courageous. Do not be afraid or discouraged, for the Lord thy God is with you wherever you go. Joshua 1:9. I was like, I hear you. So I left the organization finally in August of 2022. And I've been on this journey ever since. And I can tell you, there are some days when I'm like, it's every other Friday today. I wish
Right.
I was getting that check, but he's like, I got you.
Right.
Just as I've guided you here, I've led you in this path, I got you, and it's going to be okay. Let me handle it. You just keep doing what I told you to do, dwell on the last word I gave you, and fulfill that. And then we're going to keep moving forward.
This is deep. This is dope too. This is really, really good. This is eye-opening. This is just so mind-blowing, but it feels so freaking good. Hey, listen, guys, if you're just joining, we're here with Dr. Pierre. She's the president and owner of TRImani Consulting LLC, a leadership development and executives consulting firm. Dr. Pierre serves the leadership needs of healthcare executives and providers, education sector professionals, IT firms, government sector professionals. He has over 33 years of service in healthcare, frontline and leadership roles with various organizations. He's also served as an adjunct professor of graduate studies of health administration, nursing, public health programs for over 10 years, an assignment which he continues to love. She served as the regent for American College of Healthcare Executives, the Texas Northern Division, and served on the board of directors for ACHE North Texas chapter from 2021 to 2024. And today we're digging into her background, her story. She's already blessed us with her presence and providing tons of insight and knowledge. And listen, if you're just listening, let me provide you a little color. Dr. Trin. She goes by Trin. Dr. Trin, she's a Black accomplished female. She actually started going through the educational path in 2000. She got her ASN, her bachelor's in 2006. Then she ended up getting her master's in health administration in 2010, and then the doctorate in 2015. And now we're getting into the story that even at 2019, you found spiritual guidance. You put your head down. You started reinvesting back into yourself. And you already had a doctor's degree. You were already an RN. You were already an accomplished, healthcare executive that were coaching other executives and realized, you know what, there's a ceiling that I can't go past, but I need to do something different. So you put your head down and you started reinvesting back into yourself. And now you're inspiring and impacting the world. So this is already amazing. So I was going to ask you about your hustler's journey, but you've already been giving me insight into this hustler's journey. I would like to know, besides your sister, tell me more about, did you know that, healthcare was going to be your route? Who inspired you? Where'd your influences and all that come from?
I did. From a young age, I struggled back and forth, even through some of my college years, my undergrad years, because I was like, do I become a kindergarten teacher where I could play with the kids all day? Or do I go into healthcare? And I ultimately settled on healthcare. And it was because I wanted to be an OBGYN.
Okay.
I wanted to go that route. And I went back and forth between OBGYN and pediatrician. But the turning point was one day we were sitting in church, and I grew up in New Orleans, and we like to have a good time. Right.
Sure,
so our church, every year, our church would go on a church picnic. So we're out there and everybody's cooked out and we're doing all this stuff. And they're like, yeah, put your blankets down and go to everybody's little blanket and get you some food. It was a large congregation. It wasn't like 100 people. It was probably on the realm of 600 or so, and other churches in the area would join in.
Nice.
So we're having this fun event, but before we went, I remember being in church and everybody's in kind of relaxed clothes this day because we're going to leave and go there. And I remember one of our close family friends, she was seated in front of us, her husband, their 5 kids. And I remember she was an OBGYN. I remember her pager going off. Many of y'all might not know what that is, but it was just a little beep notification system. Right. Called me, I need to say something. Right. So a lot of the doctors had those, and some of those of us who were 24/7 employees in healthcare had to carry those dinosaurs around, right? Yeah. So I remember being a young teenager and her pager goes off, and I remember her coming back in and leaning over and telling her husband, I can't go to the cookout because I have somebody in labor. I got to go to the hospital. And I remember the look on her kids' faces. And I remember her husband being noticeably disappointed, but understanding. He was like, well, you got to go. Right. And it was at that very moment, I was like, nope. Because I believe in my time being my time, my family time being my family time. I'm not going to dedicate every single minute of my life to somebody else's child. Gotcha. And it was at that moment I was like, well, nursing may be the realm I need to go into. I still want to be in healthcare, but I definitely don't want to be bogged down to an electronic tattletale 24/7 telling me I need to go back in. So I let that go. And lo and behold, he took me on another journey to get a doctorate degree. But it was then that I said, nope, nursing is for me. I can still take care of patients, still be there, still be influential in people's lives. But I will also have a life outside of the hospital realm.
Got it. Mm-hmm. So besides your sister, was there anyone else in your family that had that medical background?
Actually, I had aunts. One of my aunts was a nurse manager in a hospital system in Louisiana. And I had a few others who were nurse practitioners and you name it, social workers, and a lot of background of giving and wanting to give back. But yeah, we had quite a few who were in that realm. And now the generation that came behind us, we have some doctors and more nurses and nurse practitioners and social workers, case managers, surgical techs, a lot of people who are in the industry as well.
So I'm picking up on is like, it was already in you intrinsically, you wanted to help others, right? And so you found the healthcare field. You're just like either healthcare or I'm going to be in education and somehow inspiring, educating, and teaching other people. So at the end of the day, you found both, right? And you was able to find both, which is great. I would love to know What exactly do you do today? Because you hit on, we talked about the medical field. You spending all these years in healthcare. You've been an entrepreneur, all these degrees. You have these partnerships with some local, big organizations here in Dallas Fort Worth. So tell me exactly, what do you do today?
Today, I am an executive coach, but my passion is leadership development.
Okay.
And what do I mean by that? Because that phrase is thrown around a lot and there's not a lot of definition behind it. For me, I'll give you my own example. When I went into leadership roles
Mhm.
or upper management roles within healthcare organizations and other realms of business, one thing that kind of stood out to me was I didn't get 10 courses of, hey, let me prepare you for. What I
Oh,
got was a badge and a key.
oh, oh,
Your office is over there. And I was
right,
like, okay. And, I'm like, I'm feeling these digs, but what I do in here, right?
right, right,
So
right.
there wasn't a lot of guidance.
Yeah.
I remember one of the roles I had, I don't think I had any training in that particular role. And it was in healthcare insurance.
Okay.
I was a supervisor for a concurrent reviewer department, and basically we approved inpatient stays and outpatient stays for patients in the hospital systems or patients who needed home health. And I remember sitting in front of a computer and being told by my then director that I would be responsible for presenting to the board. And I'm like, I'm sorry, what presenting what? The
Right,
metrics.
right,
What metrics? What you
right.
do? And it wasn't a lot of guidance, so I had to kind of figure it out. So one of the things that has kind of plagued me, and I believe what Dr. Darius Daniel says, God gives us divine irritations. And it was like that irritated me to no end that there was not more guidance to
Mhm.
tell me exactly what was expected of me in that moment and how to be successful in that role. A key and a badge. Here you go. And oh, here's your pager. Don't forget that. But at the end of the day, I started devising ways to better align people I was promoting into higher positions
Okay.
with what they needed to be successful in those roles. It's kind of silly of us to think, hey, I'm going to put this person in the role. They're going to be sustainable. They're going to do well within the organization, yet I'm not going to prepare them.
Right,
It's
right.
almost like you're waiting for them to fail, right? So I started developing plans on my own outside of my 24/7 role. I was like, when the next person comes in, this is how I'm going to train them. This is how I'm going to support them and develop them above and beyond giving them a preceptor, someone assigned to guide them in the policies, the practices, and procedures. I want to pull them in and do some coaching. At that time, I didn't know the word coaching.
Right.
I wanted to support them and talk to them about this is how you progress forward. So I started doing that in various realms, whether it was in the hospital setting, healthcare insurance, education, wherever I was. I started focusing my efforts on that. And then it became something I was known for. So now being paid to do that is something
Right.
that just sparkles my eyes and lights my little heart up because I'm being paid in what I think is my purpose. So I develop people as far as supporting them, guiding them, being not only an executive coach who is somebody who will sit and guide, but also pull out those answers that most thinking adults, and these are high level adults, people who are working in various fields. It
Mhm.
doesn't matter what your role or your level within the organization is. If you're an adult who goes to work every day, you are a thinker. That means we can work with you. And I'm able to sit and guide and lead them in that realm and show them you have the answers. I'm just helping them come to the surface. And that's what I love. But as far as leadership development within the organizational setting, for me, it is an honor and a privilege for me to go in and say, hey, yes, you've been given the key. Yes, or you're about to get the key.
Right.
Because not all of those I work with are already seated in those positions. They
Okay.
may be looking to go into those roles. So I can go in and sit with somebody and say, okay, what do you think this is about? Well, I think I have to do da 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 da. Most of the time,
Hmm.
what I get back is technical skills. I have to
Okay.
know how to do this and that and balance a budget and do staffing. But at the core of it, the foundation is what other people call soft skills. I call them foundational skills.
Mm.
How to impactfully network with others, how to manage your time so that you are allocating time appropriately in different realms. so that little Annie, little Susan, little John
Right.
don't say, I think my mama works
Right.
at da 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 da, but she never here. Kids aren't going to remember that you did this to improve their life.
Right.
They're going to remember that mama was there at my games,
Yep.
that daddy was there helping me with homework. And I don't believe in work-life balance. I believe in synergy because I
Okay.
want my home life to be up here and
Right.
work life to be down there. And I believe
Gotcha.
that's the way it's meant to be. It's not supposed to rule our lives. It's supposed to give us what we need to sustain our lifestyle. So I believe teaching people how to start off on a good foundation is integral to their success, not only internally, personally, but for the success of the organization. What do people do when they're dissatisfied? They leave.
They
They go
leave. Yeah.
somewhere else. They
Right.
right. And I've seen this time after time. We put people in these high level positions and they're overwhelmed. They
Mhm.
can't cope.
Right.
Their hair falling out. Literally, I had somebody whose hair was falling out. She lost so much weight. And I was like, girl, you sick. But no, she was sick and tired. She
Right.
just
Right.
did not know how to handle the new responsibility given to her. So it is my goal and my passion in life to show people how to navigate all of that and still be successful, how to set boundaries
Okay.
in place and still be successful. My time is my time with my family, with few exceptions. In
Sure.
healthcare, we're kind of unique because we have emergencies that come up, we have situations that arise, and you just have to go in on a Sunday at 8 p.m. It is
Sure.
what it is. But outside of those very specific emergent situations, there needs to be cutoff time where you can just spend time with your family, where you can, the Bible, God talks about Sabbath. It's a time of rest where you can be with your family and doing what you do. If we are empty, we cannot pour into others. There's a reason why on airlines we are told, put your life vest and your mask on first and then help others. Because if you're running around on empty trying to help others and you can't breathe, we all gonna be laid out.
Yeah.
I'm not
True.
about that life.
True.
So I believe in taking care, and we're hearing more about self-care, but it's a real thing. Take care of you so that you can take care of others. And I teach people that and so much more in my leadership development programs.
Okay. So, were you already a certified executive coach in like while you were working in healthcare, or is this came after you decided to make the pivot?
Yes. So I started my company in 2020,
Okay.
but it was just me starting a company because I was told. I'm
Right.
like, I'm obedient. And I did that, but I also gained my certifications during that time. So I was piling on little pieces each step of the way, but I didn't leave full-time healthcare till 2022. So for
Okay.
2 years, I was trying to grow and develop
Yeah.
myself
Yeah.
and get to where I could be developed in the dark room. So when he put me on the stage, I was ready
Ready
to
to
do
shine. Oh, I love it. I love it.
it. Thank you.
So,
Thank you.
oh
It's
yeah,
a
your
blessing.
story is so inspiring already. I hope everybody gets the chance to not only see this but watch this as well. Your body language, your expression, your excitement, the emotions that you're delivering in this podcast is phenomenal. I have tons of follow-up questions. So my first one is going to be like coaching. It doesn't matter. And one of the things you said, whether you were already on that executive path, an executive seat, or you aspire to be an executive, you can help both individuals. Is that what I'm picking up on?
Absolutely,
Okay.
because I can tell you why my focus is often people who are not yet in those roles.
Okay.
I have had the blessing and the honor of working with some of the most phenomenal leaders throughout my career, and none of them were in the chief suite.
Right.
They were all on my front line,
Right.
right? We had people who, and let me differentiate because it's the bane of my existence when you walk in organizations and you hear everybody deemed leaders. Hello,
Right.
leaders. Good morning. No, 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 no. There's management
Right.
and there's leadership. Many managers have components of leaders. Absolutely. I've worked with some of the best. But not all leaders are in roles or of authority or given positions of management.
Oh
And I
yeah.
saw that firsthand, how people who literally killed the game never
Right.
got an office key, never
Right.
got a badge that said CEO, but they were so influential that people turned to them before they turned to me or
Sure.
anyone above me.
Right.
So my focus is them because a lot of times we're giving positions and giving offices but we're not giving what's needed to support them. I've seen a lot of healthcare providers, nurses, ancillary staff who were phenomenal at what they did on the front line.
Mhm.
And then we flip them and say, oh, you're good at doing this, so you should be able to teach people and manage people in that realm, right? And they put them in those chairs and they immediately flip flopped. And many of them left healthcare or left the organization to go back to those positions on the front line
Yep.
because they felt like they failed. I feel we failed them. We didn't set. I have a strong passion for them because I know if they're developed properly, they can not only have success, but they can also pivot and put our organizations in the line of success for generations to come, because what they know and what they teach will be passed down. The goal is to make sure that those who succeed us are able to develop those who come after them, and
Okay.
so on and so forth. And I hope that's the goal for every generation, that the ones who are coming after them do much better than they did. So that is my focus when it comes to frontline and people who want to ascend into those higher roles within organizations.
Listen, man, there was a lot to go on right there. And one of the things that you had said that I picked up on is you were talking about the self-care piece, and you were talking about, how you wanted your personal life to be here and your work life to be down here. So I'm interested in knowing if you could please share, how do you go about separating the two, your personal life from your professional life? Yes. And for entrepreneurs, solopreneurs, anybody who's starting, we know that it's going to be a hustle, right? Sure. You're going to have a lot to do on the front end and the back end. There's a lot of work to be done. But what I've learned is I went from working for others in organizations and being on a pager or phone or 24/7. I'd get messages at 11 at night. I'd have people calling me at 2 a.m. talking about something that literally could have been an email the next day. So I had to set some barriers and boundaries. And the first thing I did was say, hey, these are what I deem emergencies, right? So calling at 3 a.m. to ask about PTO or paid time off. Not the time. For next week. Right. We can talk about that when I come in. Exactly. But if there's something patient related, something staff related, that's an emergency, we have to utilize first and foremost our people who are already in house. There are house supervisors, there are others who are there who can assist in that moment. That's the reason for them being there 24/7. But if you need me and it's a true emergency, I'm there. Call me and let me know. But I had to set boundaries not only in healthcare, but also in the education sector, because I'm a professor of graduate studies. And we know that grad students, my learners, are sometimes, oh, I need this answer. And I'm cool with that. I'll tell them, you can send me a text message. I might not get it till 4 a.m., but you can send me a text message at any hour of the day. But there's really no emergency when it comes to educate. What, you couldn't get your paper done? All right. We're going to work it out. It's going to be okay. But in either of those realms, I've learned that I had to keep those boundaries. The first time we back off of that strict boundary and say, okay, you know what? It's okay for you to ask me if you could have next Wednesday off at 3 a.m. in the morning. Guess what's going to happen? We just open that door and things are going to keep entering that realm, right? Mm-hmm. So I've learned to have strict boundaries and stick to them. Don't cross over and say, okay, yeah, I'm going to answer this text this one time. Because then it's going to be like, well, I texted TRImani at 3 a.m. and asked if I could eat that cake that was in the office, so you could do it too. You know, that kind of thing. So strict boundaries for sure. And then time allocation, appropriation. It has to be appropriately allocated. Yes, there's time for work. Yes, there's time that you have to do things. But then there's also time that you just want to do things, and time where you know you need to delegate that thing to someone else. But we kind of stubborn, especially in healthcare. We want to hold on to it because we're kind of like, hey, I'm the only one who can get it done right. Get out of that mindset, right? Yeah. So put your things in those three buckets. What must be done by me, those are your priorities because they're attached to your job. What needs to be done, not necessarily by you, because those are the must-haves. I must do this. I must have that on the desk by XYZ. The need to. Fiddle through those and see, do I need to do this for 10 hours a day, or can I delegate some of that to somebody else? And then the third batch is completely, you need to let go of those things and give them to somebody else.
You got to do it. Why? Because it frees up time for you. You can get what you have been assigned taken care of, which means you can get out of there on time and you can go home to your family. Now, there are times, especially in healthcare, when again, we're going to be called in the middle of the night for an emergency. Then you handle that. But don't make it a routine of, I'm just on the computer. I have colleagues to this day, and they've been doing it for 20 years, who are constantly doing this, constantly on the computer, even when they're at their kids' games,
Yep.
they miss the good shot because
Right.
their face is down and they're in. Don't do that. That's what your kids are going to remember. That's what your family's going to remember. And years to come, yeah, when they're in college or beyond, they
Sure.
may understand the why behind it. But when they're young, they just know mama didn't want to play jump rope with them or mama
Right.
didn't want to get watch that movie with them. So set those clear boundaries and keep to it. One of my clients right now, I had her set specific times where she would answer email. That's a block of time.
Mhm.
Then she would meet with employees. That's a block outside of emergencies. That's a block of time. And then she would work on projects. That's a block of time. And she literally say, these are times where I cannot be disturbed. Because if she's disturbed, that means her whole weekend is spent working on what she could have worked on, except she allowed other people to intrude on that time.
Right.
Right. So we have to set those clear boundaries. And I take that role even in my own company. There are
Okay.
days where I'm just with family. I'm not cracking a computer open.
Right.
Yes, I'm an entrepreneur. Yes, I run my own business, but I don't subscribe to the fact that I have to constantly be in this mode of what do I need to do now? Society will tell us that we have to constantly be moving and shaking and doing and
Sure.
networking and going to these events and wasting a lot of time doing busy work just because we're entrepreneur. The guideline is if you're not working 18-hour, I heard somebody say 16 to 18-hour days as an entrepreneur, then you're not doing it right. But in the kingdom, God said, my burden is light. Take my yoke. Jesus said his yoke easy. So he said you need to stride into things.
Ooh.
You don't have to overly strive because if it's him doing it, yeah, you're going to have to do some work. You're going to have to till the ground. You're going to have to plant the seed, drop them seeds. You're going to have to water it. And then you're going to have to harvest. Harvest is work too. We talk about seed time. Harvest is work. That's when you pulling stuff out of the ground. But at the end of the day, he's going to make it a little lighter load for you. It can't be, I can't go to church today, or I can't spend time with family, or we can't go out to dinner on our anniversary because
Right.
I'm supposed to spend. Culture has told me I need to spend 20 hours a day
Right.
hustling
Right.
instead of
Right. Right.
striding into what he has for us. So I ascribe to that now. I am not going to be the one who is sitting down every waking hour. I'm on the computer. And I applaud, I tell them stop it, but I applaud them for their efforts.
Sure.
My
Yeah.
colleagues who are up at 3 a.m. on the computer or scheduling business meetings, I'm like, no, no, no. There's family time, there's rest time. There's a reason why God tells us to take breaths and to rest and to focus on self-care. And we must adhere to that. The United States has the highest rate, and I say this as a healthcare researcher,
Okay.
of unnecessary deaths related to heart disease, related to stress, which leads to anxiety, which leads back to heart disease, which leads to other comorbidities, because we believe in this early to rise, late to bed, the early bird gets the
Yep.
worm, and all this other foolishness that culture has taught us. And nowhere has God said that's the way he needs his people to function to be successful. So I believe we need to set those boundaries and focus on what's most important. Always God and family first. Always, always, always. Put him in the lead, let him lead your day. I don't know what I'm doing today, but I wake up every day like Holy Spirit, take the wheel, because you know your girl swerves into other
Right.
lanes.
Right. Right.
Right?
Right.
And I lead with that. And then I'm like, okay, this is what I have planned, but what do you have planned? Do you think I need to be answering emails right now versus getting on the phone and talking to this person? And I literally stopped having palpitations every day when he told me to be still for a month in January 2023. He's like, be still.
Yes.
You got to know it's not you doing it. You
Yes.
prepare the soil, you drop the seed, and I'm gonna do the rest. Let me put the root system in place, and then you're gonna see the fruit bloom, right? But if you're trying to do it, you ain't gonna get much from it except early tombstone, and I ain't about that life
I
or the
feel like
after.
I'm not only getting education out of this, but I'm getting spiritual enlightenment and spiritual awakening through this podcast episode, which is really
Thank God.
dope. I mean, it really, really is. I mean, and you've already started hitting on some of the misconceptions, some of the pitfalls that the industry face, but I would love to explore a little bit more. What do you see are some of the pitfalls, misconceptions? Maybe it could be in healthcare and or being an entrepreneur and what you do as well. So can you shed some light
Yeah,
on?
absolutely. And some of the pitfalls that I see, I've already touched on a lot of those.
Yeah.
Those are big ones. But a big misconception is I can't do it,
Okay.
regardless of what field it's in. I
Right.
can't do in healthcare. Yeah, I see where they've gone, but I don't think I could ever, because it's too hard. I don't know the right people. These are all
Right.
self-limiting beliefs, as they're called. I call them lies from the enemy because you can do exactly, you have everything inside of you and it will come out at the right time. You
Okay.
have to develop what's already been planted, but you can do exactly what you've been called to do. A big misconception is, again, I have to spend every waking moment doing this.
Okay.
And that takes away from me time. It takes away from exercise. It takes away from family time. It takes away from rest. That is a lie of culture that tells us that we have to constantly be waking up in the middle of the night, checking our phone every
Right.
time it dings.
Right. Right.
A huge misconception that I try to steer people away from. A lot of the executives that I coach, I have to really dumb it down to the every 15-minute mark to have them write down what they're doing every 15 minutes. A lot of it is somebody came in my office and it ended up being an hour. When you could have delegated them, you could have rerouted them to 5 different people. You have all these people that you're paying a lot of money to solve problems, except you feel like you need to do it all. We don't need to do it all. I believe another misconception is grow your network and get out of thinking it's just me. I know a lot of people have said that I did this and I'm my own CFO and I'm this and I'm that. And the misconception is if I'm doing everything, then I'm a big boss.
No.
No, no. I have one CEO and his title is Chief Exalted Officer.
Ooh.
I'm just somebody who's working for him. So
Right.
I'm trying to do what he leads me to do. And if he says, broaden your horizons and move into this space, go to this networking event, let him lead, go to that event. And I have somebody there who can talk to you about running a nonprofit because she's gained multi-millions in doing that for different organizations. So I think open ourselves up. Don't think that you have to hold it all and you have to be Superman or Superwoman. It ain't gonna happen. You're gonna
No.
kill yourself in the process and you're not gonna know your family, point blank, period. So the misconceptions of those are foundational misconceptions that I think a lot of people in my circle are dealing with and trying to overcome right now in this moment. And as they do, as we do, we see changes that are just amazing to see. Better family lives, better relationships, better spirituality, spiritual relationships, and being able to hear God's voice and see Holy Spirit move in ways that no amount of hustling will ever be able to do.
Tell me more about your company, the impact that you're making, and then more importantly, how do people get a hold of you and get in touch with you?
Yeah. So my impact, I pray that it on the right track and making him proud with the work of my hands and doing exactly what he wants me to do. But I've been told to use what he gave me. I was always told I could never shut up. I got in a lot of trouble. My daddy used to come frequently. I thought he was a student at the school. They would call him in the elementary school all the time because Trinette just wouldn't shut up. If
Right.
I rushed to finish all of my assignments because I wanted to get up and go help people with theirs, right? He told me to be a helper. Do what comes naturally. Do
Right.
what comes easy to you. Support people. Motivate them. That mouth I gave you that other people say you talk too much and you don't know how to shut up
Mhm.
and you kind of dominate the meeting. I gave it to you for a reason. We got to tweak a few things, but I gave it to you because I want you to motivate and inspire others. And that is a big part of what I do. I love being a speaker. I love being able to do things such as this. Thank you again so much for allowing me to, because I want people to know you can do it. That is what I lead with in my company. If I could do it, somebody who has never run a company, I work for other people under the auspices of their control and their authority, but to be able to do it with no background in business, no real background in
Right.
entrepreneurial pursuit. I'm able to do it. And I'm here to tell you, you please listen to me. Don't listen to the lies of the enemy. You can do it. You can, if God has called you to this, I guarantee you he's going to provide for you. You may not always see it. I don't always see it, but I know it's already been laid out before the foundations of the world were in place. So I know he got it coming, right? And that's what I do. I motivate people. My goal is to go even in these independent school districts where I'm listed as a consultant and motivate those young people to let them know what you're doing today is not the end all and be all.
Mm-hmm.
Stop bullying each other. Stop killing yourselves over what somebody who don't know what their purpose is saying to you. Listen to the voices that matter around you. Go to your parents, go to people you trust, go to those older siblings or cousins or people in your neighborhood. Motivate and inspire is one of the charges I was given, and I'm so honored to be able to do that. Also with the executive coaching and leadership development piece, a lot of that creeps in, right? I might
Yeah.
not have been called in to do that, but I'm going to put it in there some kind of way. So that is my goal. That's my passion. That is, I'm hoping what my legacy will be. And also I'm hoping that I have a generational blessing down the way, not just me
Right.
doing it, but
Right.
my nieces and nephews after me and their children and so on and so forth till the Lord returns. I want everybody to be able to have somebody they can go to who can inspire and uplift and support them. And I pray that I'm making him proud in that respect.
So you're walking in faith, living in your purpose, and steady working on your steps. That's what it sounds like to me. Walking in faith is constantly working on your steps. So
Absolutely.
what I get out of that is there's always this forward momentum with you. We're not allowing past circumstances to impact what the future brings. You're constantly moving forward and making waves for yourself. And we know what happens for those waves, right? Those waves are going to
Right.
collapse on something great. And that's what
Absolutely.
you're all about. So I'm picking up on this
Yes.
hustle. I'm picking up on your journey, and I'm picking up on the impact that you're trying to make. And I hope other people are picking up on this as well. I'm interested in knowing outside of work, outside of coaching people, right? Outside of being this, healthcare executive, outside of being a motivator, a mentor, a positive influence in people's lives. Do you have passion projects or things that you work on or talk about behind the scenes that's separate from what you've already shared?
I do. Of course, my first passion is always, outside of God, and it is always my family, my friends.
Right.
And I can tell you, and I speak from experience. I can tell you that there were times when I was studying to get this degree, or I was going to nursing school, and my friends came to me one day and was like, "Girl, we don't even know you no more."
Right.
And I was like, I don't want that to be the experience going forward. I want to be present. And God is showing me that in this moment. Some of the most influential people are those who know how to impact those in their own houses, right? It's not just a business thing, but what are you doing at home? Sometimes
Right.
we put on our good face, our happy face, our great face on social media.
Right.
And then the camera's turned off and all Hades breaks loose,
Right.
right? But I want to be real in this realm with people I love who, regardless of what the world tells me I can't do, these people will always and have always had my back.
Right.
And that's true success to me, to be able to grow those relationships. And God has been leading me there over the past 2 years. He's like, just take somebody coffee just because, not because you want a contract, just because you care about people. Show people you care about them, and you'll go leaps and bounds beyond where you think you want to be. And that's my first passion. My second is one of my TRImani Consulting is my parent company. But I also have Leaders of Valor, which is a lot of my podcasting and getting on TikTok and LinkedIn and other venues and telling people that they can do it and motivating them there. And I love that because I'm also able to go out in the community and see people who are Black women, Black men, minority businesses. One I'm passionate about, veteran-owned businesses,
Right.
and giving them a spotlight. And I wish more people utilize that. But Leaders of Valor is something where I can put them in the spotlight and say, hey, I know you don't have money for a 15-second slot during the nightly news. We ain't all got that yet.
Right.
Yeah.
Right. Right.
But right now, you need people to know the great things that you're doing. So I go out and I do video shoots in that realm as well. My third
Okay.
company, another one in the umbrella, is Feed My Sheep Ministries. And it's something that God gave me all of this back in 2018, and I was scared to death. But He told me that He wanted me to focus on something I've always been passionate about, giving back to those in need,
Okay.
whether they're homeless, those in prisons, nursing homes, those who are seniors in our community who can't get the food that they need, or they don't have anybody who they could trust, who can go and get their drugs for them and
Right.
do all these things. So He has me in this realm of learning more about developing community resources and campuses where I could have a circle of hope there where people can come, and I could teach them about interviewing and resume building, and for those who are displaced, reentry programs, and those who need a second chance coming out of jails and prisons, teach them how to get back into the realm, and assign them people who can walk them through, caseworkers, and I call them accountability partners, who
Right.
can help them get where they need to be in that moment. So there's a lot going on behind the scenes. While TRImani is the parent company, those are my real passions.
Okay.
Those are the areas where I really want to focus. This is a means to an end,
Sure.
right? So my goal is to build this up, and God's going to provide the increase in it,
There you go.
and the abundance where it can overflow into those other two realms, so that I can touch communities, and my family and my friends can touch communities, and transform people's lives, people who can't pay their rent, and
Right.
people who don't know where their next meal coming from. I want to be that person who steps in, not for me to get the glory, but He said, if I be lifted up, He will draw all men unto Himself, right? It's my job to lift Him up. He already
Mhm.
lifted, but I'm just going to put my hands up there with Him, and try to lead people to Him so that they can see this life isn't all there is, but He got you even here. If one person in our community would just give back to the point, when we have a lot of beautiful people
Yep.
doing a lot of beautiful things, but we need more.
Mhm.
I feel that these food deserts and all these things that He's assigned to me to overcome, and put a knife in, and resurrect some new blood and some new things there. I believe all of that would be a thing of the past if we all
Okay.
just pulled together and work at it. So those are my passions. I'm working on developing those, and getting in realms where there are people who have knowledge in those areas who can help me move forward in those ways.
Go ahead and share, with everyone those social channels, so your handle, so they can connect with you across those socials. Go
Yeah,
ahead.
TikTok at Dr. Trend KP. Instagram is the same. And I believe you have a QR code with all my goodies on there.
Okay.
And my
Fine,
website
beauty.
is www. Yeah.
Yeah.
www.TRImaniConsulting.com, which is next to my name on the feed. And I would love to hear from you, know how I can help you, how I can motivate, assist you, and support you. I think we need more of that in this world, supporting one another. So it's not just about the me coming up. I believe we see a lot of in society today, people exchanging the we for a me. And that's something that really gets under my skin. I believe if I come up, more people coming with me. I need people to support me. I need to support others. It's about us pulling together as a community and as a people, and making sure that everybody does okay, right? I am my brother's keeper. I'm not just here for Trinette. I'm here to shine as Jesus did. I want to be His hands, His feet, His heart. And what did He do? He brought other people up. He healed others. He met them where they are. And my overall goal is to do as Jesus did, and He modeled it perfectly. No better teacher. To meet the physical need, and then you can address the spiritual need. When people know that you care about them, they're open to listening to the good news and the word that God has for us to spread throughout this earth. And that is my goal here.
Wow. I came here to be a host of a podcast and walk away with tons of education and spiritual
Mm.
enlightenment. I would like to thank you. Thank you. Thank you. Thank you. Hey, listen,
Thank
guys.
you.
This has been another episode of Health Hustle Chronicles, where the grind meets growth in the world of healthcare. As you know, I bring you some of the freshest, some of the livest guests from around the world, Craig. And today we had our very own Dr. Trinette Pierre. So a little bit about Doctor. She's a president and owner of TRImani Consulting LLC, a leadership development and of executives coaching and consulting firm. Dr. Pierre, she serves leadership needs of healthcare executives and providers, education sector professionals, IT firms, and government sector professionals. Dr. Pierre has over 33 years of service in healthcare in frontline and leadership roles with various organizations. He's also served as an adjunct professor of graduate studies for health administration, nursing, and public health programs for over 10 years, and an assignment which she continues to love. Dr. Pierre, she served as the Regent for American College of Healthcare Executives of Texas Northern Division and served on the board of directors for ACHE North Texas chapter from 2021 to 2024. She is also a proud member of the National Association of Health Services Executives, the DFW chapter, and is also an advocate of progressing the development and advancement of our Black and minority leaders within healthcare and other business sectors. One element has remained the same throughout her career. Dr. Pierre, she loves teaching, guiding, and mentoring healthcare professionals. It's her passion, and this passion is at the heart of what she does. Listen, this has been an amazing episode. Once again, Doctor, thank you for your time. Thank you for the insight. Thank you for blessing us with your knowledge. And I would love people to make sure you go to her page, you tap in, you follow her, and make sure you get some of that coaching you need to get to that next level of your career. And so to the
Thank
next
you
one,
so much.
let's keep grinding. Let's keep hustling.
We'll do.